Thank you very much. Thank you, Ambassador, for hosting this gathering. Excellencies, distinguished guests, ladies and gentlemen, I feel honored to deliver this speech on behalf of the government of Federal Democratic Republic of Ethiopia, the Ministry of Health, and myself. For the past 20 years, the government of Ethiopia has pursued its commitments to improve health and the well-being of women, men, and families by adopting and implementing a series of policies and national strategies so as to ensure all Ethiopians have access to basic social services and to foster human, economic, and political rights. Under the leadership of His Excellency Dr. Tedros Adhanom, which he hasn't yet mentioned his name, Ethiopia has taken bold measures of expanding access to reproductive health services, including family planning. We began with a comprehensive assessment of reproductive health needs in 1999. This assessment laid the foundation for the development and implementation of the National Reproductive Health Strategy, which emphasizes prioritizing the household and the community as vehicles for change, seeking more effective integration across the health sector, mainstreaming reproductive health, and ensuring its place in the national development agenda, and confronting demographic, cultural, and geographic diversity of Ethiopia. Ethiopia had identified systemic shortcomings that hamper the delivery of health services, including reproductive health in rural and remote areas. To address these issues, the government created health extension services, which were benchmarked from within the country that were being providing for the agricultural sector, the agricultural extensions. The health extension program institutionalizes common health services that focus at household and the community levels and assures sustainability and a better utilization of services. The program consists of health promotion, disease prevention, and the basic services, basic curative services, and along with basic rehabilitative services. These services are provided by health extension workers, and about 34,300 health extension workers have been trained and deployed so far to the rural villages, and around 5,080 are also deployed in the urban setup. So together it will be around 39,400. In Ethiopia, these all are on government payroll. In Ethiopia, one major factor contributing to the challenge of achieving MDG is the continued rapid growth of population. High fertility affects the health of women, their children and families, household food security, savings, and the ability to educate children. Recognize the importance of family planning for health and development. The government of Ethiopia, with a population of 80 million, has begun a range of efforts to improve access and the quality of family planning services. One significant outcome so far is the incredible and unprecedented increase in the contraceptive prevalence rates from around 14% to 29% over just 5 years, and a decline of total fertility from 5.4 in 2005 to 4.8 in 2011, as reflected in the report of the 2011 Demographic in the Health Survey. Contraceptive commodity supply is part of the overall pharmaceutical supply system, for which the government has established a federal agency to handle procurement, storage, and distribution, integrating with the other health products. To have a successful health program, commodity security plays a vital role. Without health products, there is no health. Although we have traveled a tremendous distance in improving access to health, there is still huge unmet need in the country. Though it has been reduced to 25% in 2011 as compared to 34% in 2005. One of the important elements in bringing unmet need is community security. In the past few years, there has been considerable progress towards contraceptive security in Ethiopia. These days, the federal and regional governments earmark a budget line item for the procurement of contraceptives. One persistent challenge that we have, like many developing countries are facing concerning commodity securities, timely releasing of committed funds by the different parties. There was a huge need for an innovative mechanism, and now we have a pledge guarantee for health. Using the pledge guarantee for health, we will work collaboratively to alleviate huge unmet need in Ethiopia. Ethiopia hereby seizes this opportunity to extend its sincere gratitude to Global Leaders Council for Reproductive Health for selecting Ethiopia for the 2012 Reproductive Health Result Award. I would like to also express my appreciation for the partners that have nominated Ethiopia for this award. We couldn't have won the award with the support of international and the local development partners. Thank you very much.